Jennifer here with Patient Better. Today I've got an excellent video lined up as I'm going to share with you the 3 easy steps it takes to properly read and interpret your doctor's medical notes. In this video, I'm going to show you how to break down and categorize the elements of the medical note so that you and everyone on your home care team can quickly determine what the note is for and how to follow them. By the end of this video, you will be able to read and interpret the ever so ambiguous doctor's notes just like the professionals. If this is our first time meeting, hi, my name is Jennifer. I created this channel to help you and your family learn how to self-manage care throughout your health journey. I am also the creator of Patient Better, an at-home self-health managing program. Please share this if you know someone who can benefit from watching this video to learn the best tips and administrative tools needed to self-manage care for both in-person and now virtual medical office visits. Before we begin, I'm going to take care of some housekeeping and let you know that I am referring specifically about the notes from licensed healthcare professionals because these notes are different from other types of information in your health record, but they need to be saved just like all of your other documents, as they provide a snapshot to your health and are important contributors to your entire health story that connects the other elements of your medical record. So let's begin. First, you'll need to identify the overall goal of the note and categorize their meaning into 4 principal objectives. In other words, ask yourself, what does this note do? Now, number 1, it could be a summary report, which is your medical visit summary. Or number 2, it could be a progress report, which is an assessment of your progress. Number 3, it could be a condition management report, which is a note that helps you manage your condition. Or number 4, a pre-surgical report, which is a note that helps you prepare for surgery. So let's unpack your notes. And if you forgot to take notes, don't worry, I have a link in the description below. A medical summary is a restatement from a licensed healthcare professional of the conversation and findings that occurred during your office visit. The medical summary report includes medical facts, your health history, your current well-being, and the expectation if there is going to be another medical condition in the future. When creating a medical summary, clinicians examine the completeness of your records and extract relevant information that include the results of other treatment histories and apply it to your current standing and your ability to perform daily tasks, such as work, fitness, and other social activities. This document also details any medical conditions, complaints, and medications and how they develop over time. An example of how a patient may use a medical summary report is, let's say the patient visited an orthopedic specialist to talk about a hip replacement. That summary described the patient's visits and her symptoms. The doctor outlined the next step for the patient that included the follow-up appointments. The patient used the medical summary to remind himself about future appointments that he'll need to make. He also shared his findings with his wife to help him with his care, and he saved his note in his self-health manager communication pocket during the surgery operation so he can review it and analyze it in case he wants to get a second opinion. A progress note is the report that details your clinical status and achievements during a course of a hospitalization or outpatient care treatment. An example of how a patient may use a progress note is when the patient has a weekly virtual therapy appointment with a mental health professional for depression and anxiety, which became worse after a recent diagnosis of Parkinson's disease. In the progress note, the therapist described the patient's physical and emotional health symptoms that outlined some coping strategies that were discussed in the therapy session. Upon reading this, the patient was relieved to know that her therapist understands her condition. Parkinson's disease has affected her memory, so being able to look back at the note helps her remember what she is supposed to do in between office visits. Additionally, the patient is planning on bringing this progress note along with her self-health manager to her other physicians involved in her care. A condition management report is a structured treatment plan that aims to help you better your managed health condition that will aid in providing information to help you maintain and improve your quality of life. A condition management note may include the goal of improving your overall health condition long term. Conditions such as asthma or diabetes require regular monitoring to prevent progression. A condition management report is essential to both improving outcomes and containing your costs. An example of how a patient may use a medical management report, let's say this patient has type 2 diabetes and 2 other underlying health conditions. He takes several medications and uses the note regularly to manage his health. He remembered a time that when he was in an out-of-state business trip and forgot his medication. He called in for the prescription to pick up from a nationwide chain retail pharmacy, but he realized that his dose appears to be incorrect. He was able to look over his latest condition management report on his smartphone and correct the issue. Of course, only after business hours. Additionally, his endocrinologist involved in his diabetes management is not located in the same hospital where he received the rest of his care. But he was able to print and store the report and document this oversight in his health notebook and bring it to all of the other physicians' attention involved in his care. He has a very busy schedule to juggle, and he finds it very important that his entire healthcare team has access to the same information. This condition management note made him feel more like an expert in his condition, and despite his complicated medical life, he feels healthy. And the fourth note is a pre-surgical report that serves as a pre-operative assessment of your medical history and your current health status, as well as your home circumstances. This document also takes into consideration any medical problems that you may need to treat before surgery and any special care that you may need after surgery. An example of how a patient may use a pre-surgical note is, let's say, when a patient is required a throat operation and her endocrinologist needed to determine if a breathing tube could be placed in her airway during surgery. The surgeon summarized her medical history and described the examination that was performed. The note contains some difficult terminology, and the patient did not quite understand these words, but still liked having the note. She was able to look up these terms online and wrote a list of questions for her pre-operation for surgery, to prepare for her surgery. She also shared the note with her primary provider that was at a different hospital affiliation other than her surgeon. For the second half of this video, we will look into the structure of the medical notes. 4 out of 5 doctors construct medical notes using the SOAP note method to document all patient encounters. This form of medical note-taking is an integral part of the practice's workflow and is a way to communicate with others. So when you request a medical note, the chances are greatly in your favor that you will find the medical notes in this layout. In other words, your notes will be created with one of the 4 principal goals in the SOAP note layout. Here is the overall layout of the SOAP note, which you can read about in greater detail in my book, A Comprehensive Guide to Self-Health Management, or already might be yours that came in your doctor's self-health management program. The S stands for subjective, which is the patient's initial chief complaint and is a brief statement of the purpose of the visit or hospitalization. The O stands for objective, which is the element of the provider's observation and a possible measurement of the illness or injury that brought you into the office. The A stands for assessment, which is the assessment of the summary of the medical visit and a report of your principal symptoms. And P stands for the plan, which is what the clinician plans to do to treat your concerns, such as ordering lab tests, radiological workup, referrals, procedures, prescribe medication, or even provide patient education. To wrap things up, you have 4 objectives in your report that include a summary, a progress report, a condition management report, or a pre-surgical report. And most of the time, these reports will come in a SOAP note layout. Lastly, ask yourself the following questions when reading your medical notes. Are the medications, symptoms, and health conditions accurate? Does the information in the note reflect what was discussed during the office visit? Is the information something that I want to share with my other health providers on my healthcare team? Is there anything on the report that I need to clarify? Is there anything that I don't understand that may require research or a professional clarity, such as medical terms, a diagnosis, or treatment recommendations? Is there information like symptoms, family history that I forgot to share during my appointment? Are there any inaccuracies in my note that should be fixed? And if you find this video informational, go ahead and write medical notes in the comment section below. And if you want more information, please visit my website at www.patientbetter.com. I look forward to seeing you next time, as I've gotten a really good video about Patient Better's signature product, the one and only Self-Health Manager, and how it became the key instrument in self-health managing. And if you want more videos like this to learn the best tips and administrative tools needed to self-manage care for both in-person and now virtual medical office visits, go ahead and smash that subscribe button and ring that bell. See you next time, and thank you for bringing me with you on your health journey.